Okay guys, this is the second video on renal dysfunction. So we left off talking about stones, about kidney and uric acid stones. So now we're going to talk about obstructions in the lower urinary tract. So the lower urinary tract would be things like the bladder or the urethra. Okay, so a neurogenic bladder. Okay, remember that your bladder's main job is to store and then eventually expel urine. The lining of your bladder was that transitional cell epithelial tissue, which hopefully you remember from AMP1, that, remember, the cells kind of laid over each other. So then when your bladder expands, they can kind of separate and flatten out. That gives your bladder the ability to expand and hold a fair amount of urine. And then there are receptors at the surface of your bladder wall that will then connect to the nervous system to tell you time to go find a toilet or a tree, and then you void your bladder via a reflex called the micturition reflex. So if someone has a neurogenic bladder, what we're saying there is there's something neurological going on, whether there's nerve damage, for example, or damage to the brain, the area of the brain that controls the micturition reflex, whereby someone would have the inability to know A, their bladder's full, or B, that the mechanism to void it is challenged. They do have ways of stimulating the bladder, kind of doing it almost like a pacemaker would stimulate the heart. And that would tell the patient that they need to void their bladder. So there are mechanisms to treat these. I just wanted to bring them up as kind of a very general thing. Okay. So then the urethra. Okay. So the urethra is the passageway for urine, but in men, it is the passageway for both urine and for semen, remember. So one of the things that can obstruct the urethra in men is when men have an issue with the prostate. So the prostate can be enlarged for a number of reasons. And we had talked a little bit about BPH when we talked about alterations to cells and talked about hyperplasia versus aplasia, atrophy versus hypertrophy, etc. So we're just going to attack this from a different angle now. So if the prostate, remember you're in males, I'm going to switch colors and then really embarrass myself when I draw a bladder and a urethra. Okay, so in males, here's the bladder. Here's the urethra going to the penis, which is at a right angle anyway. Remember, the prostate is just under the bladder. I hope you can see this incredible artistic rendering of a bladder and a prostate. So if the prostate is enlarging, it's going to squeeze into and push against the wall of the urethra. And that's going to kind of constrict the wall of the urethra so that urine flow through the urethra is going to be compromised in that area. So some of the reasons the prostate can become enlarged, we had discussed BPH. You could also have prostatitis or prostate cancer. So we can either have inflammation of the prostate, prostatitis, which can be bacterial in nature. BPH, which we had talked about already, but is probably the most common reason that the prostate becomes enlarged in older men, or prostate cancer. Now, obviously, if it's prostate cancer, it varies from anything from watch and wait to removing the prostate, depending on whether or not it's metastasized, the age of the patient, etc. If it's prostatitis, it is treatable very often with an antibiotic because it's bacterial in nature. So that takes these two out of the equation. We can treat those. But BPH, not that there's no treatment, but because you have a hormonal change that drives the hyperplasia, the way that we can attack this problem is kind of to relax the muscles all around the bladder and around the urethra so that you'll have an improvement in urine flow. Okay. In females, All right, we have a unique problem. All right, pelvic organ prolapse. And so now we can talk about a cystocele. Okay, I'm going to say this very slowly because we have to understand this and kind of get a visual on it. It's when the bladder starts to bulge into the vagina. How does this happen? Because the supportive tissue between the bladder and the vagina tends to weaken, and the bladder sinks down and starts to protrude into the vagina. Okay, very often this can happen associated with childbirth, which strains the tissues in and around the uterus and the vagina. Remember, if you're having a vaginal birth, that's a huge strain on all the tissues surrounding that muscular wall of the vagina. In addition, aging, you can just have weakening of that tissue just as a byproduct of age. Obesity, again, you have pressure bearing down in that area. Or hysterectomy. Now, if someone can develop a cystocele years after the initial injury has occurred, one of the symptoms a patient has a cystocele is urinary incontinence, which means they have loss of bladder control. So someone may step off a curb or sneeze and they pee their pants, okay? Also pain and pressure. You can imagine when somebody's standing, okay, you're gonna have a lot of pressure in the pelvic and the vaginal area. The fix for this is surgically, we want to kind of shore up the tissue again and shore up the bladder so that it's not bulging down towards the vagina. Kegel exercises to strengthen those pelvic floor muscles, and to get immediate relief of pressure in the pelvic and vaginal area, you'd want to sit in the recumbent position. Okay? All right, so then the next piece I want to talk about is different types of tumors. So we have renal tumors and bladder tumors. All right, so renal tumors. Okay, there are two different types. There are renal adenomas, those are benign tumors, and then you have those that are, they're RCC, which is in your notes, it's renal cell adenocarcinomas. That's probably the most, this is definitely more, is malignant, and is one of the more common renal carcinomas. So, who do they occur in? More often in men. Age is a risk factor, of course. So the risk for developing this type of tumor increases with age. Other risk factors include smoking, which is a risk factor for many types of cancers. But one of the big things that I want to talk about in terms of renal function is another huge risk, so these are all risks, is uncontrolled hypertension. All right, so as a sidebar, we are going to discuss hypertension. When we do the vasculature, we're going to discuss hyper and hypotension. So that, it's not that I'm going to launch into a large discussion about this now, but uncontrolled hypertension. So first we think, how could someone have uncontrolled hypertension? Wouldn't you know you had high blood pressure? Oftentimes people have elevated blood pressure, are unaware that they have it. They don't always have any signs. Some people have no signs and symptoms that their blood pressure is going up. And so if they're not regularly seeing their doctor or having blood pressure assessed in some way, they may not be aware that their blood pressure is high, okay, and is chronically high. So what this can do when someone has uncontrolled hypertension is, because your kidneys are filtering tremendous volumes of blood all day long, if that blood is flowing through the kidneys at very high pressure, it can cause significant damage to the kidneys and put you at risk for renal tumors as well. So, signs and symptoms of a renal tumor would include things like hematuria, means you have blood in your urine. Okay, now again, you can have blood in your urine for other reasons, right? A kidney stone, pain. In some people, they have a palpable flank mass that you can feel. Remember, the Kidneys are retroperitoneal. They're outside the peritoneal cavity. So if the mass was large enough, you may be able to feel it, so it would be palpable. The treatment for renal tumors is to remove the affected kidney. Obviously, you can live with one kidney, of course, or just remove the tumor depending on the size of the tumor. Other types of treatments we can use are immuno-based in nature. Sometimes we use immuno-based therapies for cancers because some tumors tend to be chemotherapeutic resistant, that they don't respond well to chemo, so they'll use an immunotherapy-based treatment. So, for example, angiogenesis inhibitors. What this is going to do, angiogenesis inhibitors were developed probably 25-ish years ago. What they do is inhibit blood vessel formation. And one thing that some tumors can do is form their own blood vessels, and then they can kind of feed themselves and take nutrients out of your bloodstream that should be going to your tissue. So if we can inhibit that process, the idea is then the tissue is essentially starved and won't survive, okay? We can also use T-cell activators. Remember, certain types of T-cells are good at attacking your own cells that are behaving in a cancerous manner. And so if we can somehow give those T-cells a little boost, you're getting your immune system to do what it normally does fairly well, even better, okay? Okay, bladder tumors. All right, so bladder tumors, again, most of these are transitional cell. Remember, this transitional cell was the transitional epithelium. That is very unique in the bladder. Most bladder tumors are transitional cell carcinomas. Many of them are non-invasive, okay, and superficial. They are more common in men. Age is definitely a risk factor. It's men over 60. One of the risk factors for bladder tumors is exposure to arsenic. Okay. Arsenic is found in some cases in drinking water. Now, the EPA sets standards for all kinds of different elements and compounds in drinking water, and sets what's called acceptable limits for those things, meaning things that at low levels, those consumables are safe, right? So I'm sure if you looked at drinking water in many areas of this country, you might have very low to almost non-detectable levels of arsenic in the water, okay? Sometimes you'll hear it pop up in the news sometimes that drinking water was tested with elevated levels of arsenic. Elevated levels of arsenic in drinking water is a risk factor for developing bladder tumors. Another one is a consumption of an analgesic called fentanyl, which is no longer available in the US, but is available in some areas of the world, and certain types of infections. The treatment for a bladder tumor will depend on how extensive the tumor is, but the risk, of course, there is for developing secondary tumors in the prostate, in males, or just in the cervical, in the cervix in females, okay? What are some of the symptoms? Again, blood in the urine. So you have hematuria, you have nocturia, which means that you're waking at night to void your bladder, an increased urge to urinate. Unfortunately, in men, these symptoms are very similar to an enlarged prostate. Okay, so again, sometimes people will kind of write these things off as something harmless, but could be something that's quite harmful. And an increase in daytime voiding. You're voiding your bladder more often. You can remove the bladder. Obviously, that would require that someone have an additional catchment space to grab the urine, of course. But if it would depend on how extensive the tumor is and if a secondary tumor is in place. Okay. All right, we're going to talk about urinary tract infections, UTIs. Okay. UTI means you have inflammation of a urinary epithelium. This is usually caused by bacteria from the gut. What? We'll get to that in a minute. Okay. Cystitis, or inflammation of the bladder, is more common in women than in men. Generally speaking, people who have acute cystitis, it is fairly mild and doesn't really involve any secondary complications. However, some people have bladder infections that are quite extensive, involving several different types of bacteria, and you can be on antibiotics for weeks because of a simple UTI. Most of the times, if the acidity of your urine should kill most bacteria that would be in the general area that would trigger a urinary tract infection or cystitis. Who is at risk? We still haven't gotten to that yet. Okay. Prepubescent children, women who are pregnant, those under antibiotic treatment. Okay. If you're immunocompromised, you are at higher risk. Someone who is catheterized is at higher risk. Okay? Spermicide. The use of spermicide puts you at a higher risk for UTI. Why? Because the spermicide that's coated over a lot of condoms and is sold over the counter is it may damage some of the beneficial bacteria that would be something that would help combat developing a UTI. Okay? Patients with diabetes or anybody with a urinary tract obstruction, right? If urine cannot flow out properly, then your risk for developing a bladder infection will go up. Okay? How is it getting there from the gut? We're not wiping well. Okay, we have to wipe from front to back, ladies, not from back to front. Remember, in your feces, there's millions and millions of E. coli. And that is the leading cause of acute cystitis is E. coli. So if you're wiping from back to front or you're not practicing proper hygiene, some of the E. coli can invade the opening to the urethra and then retrograde as far back as the bladder and trigger acute cystitis. It can also trigger vaginitis, okay, and bacterial infection through the vagina. So we want to be careful about the way that we wipe. Intercourse. Okay, if you're engaging in anal intercourse, we need to make sure that we change the condom in between the anal part and the vaginal part. You can spread bacteria attached to the condom from one space to another, and that can trigger vaginitis. Okay, so hygiene is extraordinarily important. Okay, so let's talk about acute cystitis. So acute cystitis means, okay, this doesn't want to come apart. You have inflammation of the bladder. All right, so if you have inflammation of the wall of the bladder, you can imagine that you would feel a lot of pain, but you would feel some pressure, right? And that you would think that that pressure meant that you had to avoid your bladder, so it's going to increase our frequency to urinate. This is the most common site of a urinary tract infections. More often than not, they are caused by E. coli. So this is our causative agent. Okay. How can we characterize this? We can do a procedure called a cystoscopy, which will look to see what the wall of the bladder looks like, that we could characterize whether the bladder wall is inflamed. Okay. Because you have inflammation of the bladder wall, you're going to have some edema associated with that and some swelling. That's going to trigger some of our symptoms like pain, pressure, frequent urge to urinate, you might have cloudy urine because of the presence of bacteria, the presence of pus or leukocytes in the urine, which can be, that data can be ascertained by doing a urine culture. Okay, so if we diagnose via a urine culture and then treat with antibiotics, that are specific to the microorganism that's triggering the cystitis. The time frame can be anywhere from a few days, that for some people it can be several weeks to a month that they're on antibiotics. Okay. Two other infectious issues that we want to deal with. One I'm going to deal with right now, and then the other one we're going to come back because we want to talk about glomerular nephritis, then segue into kidney failure. So, pyelonephritis. So we have to remember what is doing all the work in the kidney is our nephrons. Okay, and this would be acute. So you have a sudden onset of pyelonephritis, which means you have an infection in the upper part of the urinary tract. So now we're not talking bladder or urethra, you're talking kidney ureter neighborhood. So we've got something going on perhaps in the kidney itself. Okay. The most common trigger for this is bacteria, and that bacteria, again, E. coli. You have the sudden onset of pain, chills, and fever, okay? And again, the pain can be localized a little bit higher than would be for kind of that pressure that you would feel with bladder pain. You would have painful urination and the frequent urge to urinate. Again, because bacteria is generally the problem, the treatment is antibiotic therapy. Okay, we're going to stop there, and when we come back, we will finish with glomerular nephritis and then start working our way into kidney failure.